this segment is going to review cost information in the Part D event data. So this might be kind of obvious to most, but there are many reasons why we would use PDE cost variables, and many researchers are interested in medication spending. I mean, it is a very large portion of the overall Medicare program, and healthcare in general is very large portion of GDP. So right. Of course, researchers are going to be interested in examining spending. Questions such as how much do beneficiaries with a specific condition spend on medications? What is the monthly cost of a specific drug? What is the average out-of-pocket spending on drugs among PDE enrollees? We want to get the perspective of the burden on members. So cost variables in the PDE data will allow us to answer these questions. The PDE file contains information just so that we understand what it does and does not contain. It contains information on point of sale cost of drugs. So the costs associated with the Part D event. So what it does not contain is information on Part D plan-specific bid, rebates, reinsurance, or payment data that are collected outside of the Part D event. And this is to protect commercially sensitive plan data that companies consider proprietary. So for this reason, researchers can't determine the true full costs to Medicare or the plan for prescription drugs using the PDE data. But we can look at the cost, the point of sale cost. So the most commonly used PDE fields to measure drug spending are the total RX cost amount, otherwise called gross drug cost, and the patient pay amount. So gross drug cost, you would use that to identify the total cost of the drug, and patient pay amount, like the name sounds, is what you would use to identify that amount that the beneficiary paid out of pocket. The total cost of the drug, total gross cost, is actually kind of is the sum of some different components that we have listed underneath the second bullet. These variables are not available in the PDE data, but just so it just is kind of good to have the background of kind of what different components are that go into that variable. So there's the ingredient cost, the dispensing fee, total amount attributed to sales tax, and starting in 2010, the vaccine administration fee. The mean, if we look at all the drug event records in 2021, the mean of this variable is about $143, whereas the median is $13.60. So you can see how there are some very high cost drugs that are pulling that mean far above the median. And that's kind of, I think, a good kind of like characteristic of drug data. There are like most fills are low cost drugs, but there are some extremely expensive drugs that skew the distribution when it comes to cost. So if we want to take a look at who pays for this gross drug cost. This pie chart shows you kind of an average percentage of who pays. But this is not like most records have meaningful values in these categories only on a few elements. So this is not really like your typical record. So just wanted to emphasize that this is, if we average these components across all records in the PDE, this is what you get. So on average, 63% of the cost is paid by the plan, and that's in yellow, the covered plan paid amount. Followed by about almost 15% is paid by the low income subsidy. Next is the patient pays about 8% on average. And then the gap discount covers about 7%. That's in gray. Followed by 4% is the PLRO amount. And then 3% in orange is the non-covered plan amount. And then a tiny fraction, 0.3%, is the other troop amount. And we're going to go over each one of these components a little bit more in detail right now. And so this just kind of shows you that if you take all of those 7 components and add them up, and these components are available as variables in the PDE data. If you add them all up, you should arrive at the gross drug cost variable. So yeah, now let's go into these 7 components that go into the gross drug cost, and we'll start with the patient pay amount. So like the name sounds, this is the amount that the beneficiary paid that was not reimbursed by a third party. This amount contributes to the true out-of-pocket amount for the member, but only for covered drugs. Remember, the out-of-pocket amount is tracked by Part D to so that they can determine what phase a member is in their drug coverage. I mean, prior to, so that they can track what the different phases that the member is in their coverage throughout the year. So the true out-of-pocket amount is only for covered drugs, but the vast majority of drugs in the PDE data are covered, 99.6%. So just a very, very small amount are not Part D covered, but they might be covered by a Part D plan if it has enhanced benefits. But the vast majority of Part D events are going to be covered. The mean patient pay amount in 2021 was $11.90. But if you break that out, separate the population into those with the low income subsidy and those without, the mean becomes diverges quite a bit. Those with a low income subsidy only paid $1.31 on average, while those without paid about $17. So next we will move on to the low income cost sharing subsidy amount. That's the LICS amount. So there's a variable in the PDE data that will tell you how much LICS covered. Again, this is going to show you the amount that the LIC paid, or in another way to put it, the amount that the plan reduced patient liability due to a beneficiary's LICS status. CMS reconciles prospective LICS payments made to plans with actual LICS amounts incurred by the plan at the point of sale. So It's kind of like it's eventually like the accounting's all, shakes out, maybe, at some point in the year. And, it's reconciled with CMS kind of after the point of sale. So in 2021, 34% of records in the PDE had an LICS amount. And the mean amount was $60.88. The median $8.28, and the mode was $3.70. The next component we'll talk about is the other true out-of-pocket amount. This records all the qualified third-party payments that were made on behalf of a beneficiary. So, you can get the amount the beneficiary actually paid, and in that variable, this will record any other amounts that apply to the troop, but were not paid by the Benny. And it does not include the LICS subsidy amount or patient pay amount. And examples of these third parties are like qualified state pharmacy assistance programs and charities. And there are other troop eligible parties as well. When it's populated, its mean value is about $26.27, but they're only about 1.5% of all PDE records are populated with a value greater than 0 for this other troop amount. The next component is patient liability reduction due to other payer amount, or PLRO amount. This is the amount the patient liability is reduced due to other benefits. Examples are group health plans and workers' comp, but these payers are not troop eligible, so they don't participate in Part D, and these amounts don't apply to members' out-of-pocket tally. About 12.5% of PDE records have a non-zero PLRO amount. And when populated, the mean is $48.79 as in 2021. Next component is the covered D plan paid amount. And that is the amount the plan paid. So this is kind of what the minimum and mode is 0. And that's going to be for those events that are in the mostly the fills that occurred in the deductible phase. The mean amount paid by the plans is $90.53. The median is only $1.36. So yeah, again, those high cost drugs are really pulling that mean up. The next component that goes into the total gross drug cost is the non-covered plan paid amount. This applies to plans with enhanced benefits. So it's kind of going above and beyond the minimum Part D required benefits. This amount is rarely used or considered for research, but it's tracked because it's useful for CMS accounting and planning. This amount, these enhanced benefits are usually, are going to be recouped by the plan through higher premiums. So one thing we just want you all to be, we wanted to include in the slide deck, even though this variable isn't really often used for research, we regularly get, a couple times a year, get questions from Part D users data users about negative values in this field. And so these next two slides kind of explain why you might find those instances. It's kind of when the plan's benefit structure is sort of a little bit such that what they pay is not what your standard Part D plan would pay. So therefore it results in a negative value. But so you can refer back to these slides if it ever comes up. Just make a mental note that this deck contains an explanation if you are ever wondering and you can't remember. The final component is the reported gap discount. And so the amount of the discount provided by the drug's manufacturer under the Medicare coverage gap discount program, as calculated by CMS based on data reported in the PDE, is the gap discount. The gap discount program started in 2011, but it's only available as its own distinct variable in the RIF data starting in 2012. So in 2011, there is no gap discount variable. So if you're working with that year, just be aware of that. But know that the gross drug cost does still continue to include the full cost of the drug. It just does not reflect any coverage gap discounts that may have been applied. Therefore, if the sum of the 6 variables is less than the gross drug cost, and if the event was in the coverage gap phase of the benefit, then the difference in these amounts can be assumed to be the gap discount. So if the gross drug cost in 2011 is $65.20, and you know that the Benny is in the coverage gap phase, there's a variable in the event data that you can use to determine that. If the patient pay amount is $553, adding all the 6 components together, you get $59.67. The difference can be assumed to be the gap discount. That's for 2011 data only. If you're using data from 2006 to 2010, there was no gap discount. So it's just, simply summing the 6 components you see here should equal the gross drug cost value. So let's just kind of talk about some hypothetical questions, research questions, so you can kind of maybe try to imagine, apply what we just talked about and to a research question, and you can think about how you would use the data for these questions to answer these questions. So suppose you are interested in the average annual drug spending per beneficiary. What variables would you use to get at that? The second question might be, suppose you're interested in the average monthly cost of a particular drug like Gleevec. What variables would you use in that case? So, for the top one, we want the, we would need to sort of use, the key variable, the one we've been talking about so much, that would be the gross drug cost. Simply using the gross drug cost would be the variable to use in this case. And then, of course, you would need to gather the count, the number of bennies, and do a few other things to arrive at the answer. But yes, the key variable there is gross drug cost. So for the second question, Again, it's, using that gross drug cost and then in this case, dividing by the day supply and multiplying by 30 to get it on a monthly basis. And here's another question. What variables would you use to get the patient out of pocket spending? So there are, sort of three options. One, definitely you would want to use the patient pay amount, and that's the top one in blue. The two in green, sometimes researchers use them and sometimes they don't. It's my understanding that they would rarely change your conclusions because they are kind of such a small factor in out-of-pocket spending. But so some researchers choose to calculate the out-of-pocket spending, one way or the other, or they do both just to cover their bases. So, and I'll end with this fine graph that one could reproduce this very nice informative chart graph using the PDE data. It has all of the components you would need to recreate this. It has you're choosing specialty cancer drugs, so you could use the NDC. I imagine to identify those drugs, and you can identify beneficiaries without low-income subsidy using the MBSF and linking to the PDE. Or there's also the LIS amount in the PDE. Maybe selecting those with zero might work as well. Might be good to do some testing, see if there's consistency between the MBSF and the PDE in that sense. That would be interesting to look at. But yes, and then you have the total out-of-pocket spending. You identify that with the cost variable that we just discussed, and find the gap phase and all the parts.